The host welcomes viewers to the Joe Rogan Podcast Summary channel, introducing the episode with enthusiasm. They announce that today's video summarizes episode number 2304 of the Joe Rogan Experience, featuring Gary Brecka, a human biologist and biohacker known for his insights on health optimization. The host encourages viewers to like the video and subscribe to the channel, emphasizing that support helps deliver more summaries of Joe Rogan's thought-provoking conversations. They set the stage for a deep dive into topics like health policy, diet, mental health, biohacking, and more, promising a comprehensive look at the episode's highlights. The discussion begins with Joe Rogan and Gary Brecka exploring the state of health policy in the United States. They express concern over the nation's approach to chronic diseases, which Gary argues are escalating despite massive healthcare spending. He highlights that the U.S. allocates $4.5 trillion annually to healthcare, more than any other country, yet ranks 66th globally in life expectancy. Gary points to alarming statistics. Over 40% of Americans are obese, and diabetes rates are climbing, particularly among younger populations. He attributes these trends to systemic issues, like prioritizing treatment over prevention. Gary shares his support for Bobby Kennedy's health movement, which seeks to uncover the root causes of chronic illnesses. He describes Kennedy's push for transparency in healthcare and environmental factors, suggesting that policies often overlook the impact of toxins and poor nutrition. Joe agrees, noting that the system seems designed to manage symptoms rather than solve underlying problems. They discuss how regulatory bodies sometimes fail to address harmful practices, citing examples like outdated food guidelines that promote high-carb diets despite evidence linking them to metabolic issues. The conversation digs into the complexity of healthcare reform. Gary argues for a shift toward preventative measures, such as incentivizing healthy lifestyles through tax breaks or subsidies for organic foods. Joe questions whether bureaucracy stifles innovation, pointing to slow adoption of alternative therapies. They both express frustration that public health campaigns rarely tackle controversial but impactful topics, like the influence of pharmaceutical companies. This section of the podcast underscores their belief that rethinking policy could save millions from preventable diseases. Next, Joe and Gary delve into diet, a cornerstone of the episode's health discussion. Gary takes aim at processed foods, particularly seed oils like canola, soybean, and corn oil. He explains that these oils undergo intense processing, involving chemicals like hexane and sodium hydroxide, which he claims leave residues that contribute to chronic inflammation. Inflammation, Gary notes, is a precursor to conditions like heart disease and arthritis. He contrasts seed oils with natural fats, advocating for beef tallow, olive oil, and avocado oil as healthier alternatives that support cellular function. Joe chimes in, sharing his own experiences with dietary changes. He describes how cutting processed foods improved his energy and recovery from workouts. Gary builds on this, emphasizing the benefits of whole foods, fruits, vegetables, and pasture-raised meats. He introduces the concept of regenerative agriculture, which prioritizes soil health to produce nutrient-dense crops. Gary highlights a farm in Florida he's worked with, where produce is harvested and delivered within hours, retaining maximum vitamins and minerals. This approach, he argues, could revolutionize food systems if scaled. The pair also explores the pitfalls of modern diets. Gary criticizes the prevalence of sugar and refined carbs, linking them to insulin resistance and obesity. He cites studies showing that high fructose corn syrup, found in many sodas and snacks, disrupts metabolism more than other sweeteners. Joe recalls past guests who've echoed similar views, reinforcing the idea that dietary habits drive many health crises. They discuss the importance of educating consumers, noting that misleading labels like low-fat products packed with sugar confuse the public. Gary offers practical advice for listeners. He suggests starting with small changes, like swapping seed oils for olive oil in cooking, or choosing grass-fed beef over grain-fed. He also stresses the value of seasonal eating, explaining that local, in-season produce aligns with the body's nutritional needs. Joe wraps up this segment by reflecting on how ancestral diets, like those of hunter-gatherers, avoided many modern ailments, setting the stage for the next topic. The conversation shifts to mental health, where Joe and Gary address the toll of isolation on well-being. Gary cites research linking loneliness to reduced life expectancy, noting that it's as harmful as smoking or obesity. He points to rising depression and suicide rates, particularly among teens and young adults, attributing much of it to social disconnection. The pandemic, he adds, exacerbated this by limiting in-person interactions, leaving lasting effects on mental resilience. Joe shares a personal angle, recalling how physical activity and community helped him navigate tough times. Gary agrees, emphasizing that humans are wired for connection. He describes how time in nature, hiking, gardening, or even walking barefoot on grass can lower stress hormones like cortisol. He references studies showing that exposure to natural environments boosts serotonin, a key mood regulator. Joe nods, mentioning his love for outdoor activities like hunting, which he finds grounding. They explore the role of technology in mental health. Gary warns that excessive screen time, especially on social media, disrupts dopamine cycles, leading to anxiety and dissatisfaction. He suggests balancing digital habits with real-world engagement, like joining a sports team or volunteering. Joe brings up the idea of tribe mentality, arguing that humans thrive in tight-knit groups, a dynamic eroded by modern lifestyles. They both stress that rebuilding community, whether through family, friends, or shared hobbies, is critical for mental health. Gary offers actionable tips, urging listeners to prioritize face-to-face interactions and limit device use before bed. He also highlights the mental benefits of exercise, noting that even 20 minutes of movement daily can reduce symptoms of depression. The discussion leaves viewers with a clear message. Fostering connection and staying active are non-negotiable for a healthy mind. The episode's most futuristic segment centers on biohacking, where Gary shares cutting-edge strategies for extending life and optimizing performance. He introduces hydrogen gas as a tool for reducing inflammation and enhancing cognitive function. Gary explains that inhaling hydrogen or drinking hydrogen-infused water delivers antioxidants directly to cells, neutralizing harmful free radicals. He cites a November 2021 study from the Journal of Experimental Gerontology, where elderly participants who consumed hydrogen water for 6 months saw a 4% increase in telomere length, a biomarker of cellular aging. Joe, intrigued, presses for details. Gary describes how telomeres, the protective caps on DNA, shorten with age, leading to disease and decline. The study's findings suggest hydrogen could slow this process, offering a glimpse into anti-aging science. Gary adds that hydrogen therapy is accessible, with devices now available for home use, though he advises consulting experts for safety. The conversation pivots to hyperbaric oxygen therapy, HBOT, another biohacking frontier. Gary recounts a study where participants underwent 60 HBOT sessions, breathing pure oxygen in a pressurized chamber. The results were stunning. Telomere lengthening equivalent to a 20-year reduction in biological age, alongside improved cognitive scores. He explains that HBOT floods tissues with oxygen, stimulating repair and reducing inflammation. Joe shares that he's tried HBOT and felt sharper afterward, sparking a discussion about its potential for athletes and brain injury patients. Gary doesn't stop there. He touches on other biohacking tools, like red light therapy, which he says boosts collagen production and speeds wound healing. He also mentions wearable devices that track sleep and heart rate variability, helping users fine-tune their routines. Joe jokes about becoming a cyborg with all these gadgets, but Gary insists that biohacking is about empowering the body, not replacing it. They explore the science of supplementation, with Gary advocating for personalized approaches based on blood tests. He mentions common deficiencies like vitamin D, magnesium, and omega-3s that undermine health. Joe reflects on how testing revealed his own low testosterone years ago, leading to lifestyle changes that boosted his vitality. Gary stresses that biohacking isn't just for elites. Simple hacks, like optimizing sleep or using sauna therapy, are game changers for anyone. This section wraps up with Gary's philosophy. Biohacking is about taking control of your biology through data and discipline. He encourages listeners to experiment safely, track results, and consult professionals. Joe agrees, noting that small tweaks, like cutting blue light exposure at night, have outsized benefits. The discussion leaves viewers inspired to explore biohacking as a path to longevity. Throughout the episode, Gary weaves in practical advice drawn from his expertise and personal journey. He emphasizes sleep as the foundation of health, recommending 7 to 8 hours nightly in a cool, dark room. He also stresses hydration, suggesting mineral-rich water to support cellular function. Gary shares a story about overcoming mold toxicity, which he discovered through a vibrant wellness test, a comprehensive blood panel that revealed hidden imbalances. This experience, he says, reshaped his approach to health, Joe connects with Gary's emphasis on testing, recalling how monitoring his own biomarkers improved his diet and training. They discuss the importance of listening to the body, whether it's fatigue signaling overtraining or cravings hinting at nutrient gaps. Gary offers a step-by-step plan for beginners. Start with a baseline health assessment, eliminate processed foods, add movement daily, and track sleep. He also recommends mindfulness practices, like meditation or journaling, to manage stress. The pair reflects on the power of consistency. Gary argues that health isn't about quick fixes, but daily habits compounded over time. Joe agrees, citing his own discipline with jiu-jitsu and diet as proof that small choices add up. This segment reinforces the episode's actionable tone, giving viewers clear steps to apply in their lives. The host returns to wrap up the summary, noting that Joe Rogan and Gary Brecka covered an incredible range of topics in episode number 2304. They highlight the key takeaways: the need for health policy reform, the dangers of processed foods, the mental health crisis fueled by isolation, and the promise of biohacking for longevity. The host encourages viewers to watch the full episode on the Joe Rogan Experience channel for deeper insights, available at the provided YouTube link. They also point viewers to Gary Brecka's resources for further learning, mentioning his website, The Ultimate Human, and Instagram handle, Gary Brecka. The host reiterates the importance of engaging with the channel, asking viewers to like the video and subscribe to stay updated on future summaries. To boost interaction, the host invites viewers to share their thoughts in the comments. They pose questions like, what did you think of Gary's biohacking tips? Have you ever tried hydrogen therapy or changed your diet based on a podcast? The host signs off by thanking the audience for watching and promising more Joe Rogan summaries soon, leaving viewers motivated to explore the episode's ideas. Like and subscribe my channel. Thank you.